Good afternoon, and thank you so much for joining us today. My name is Gabby Vendries, and I work as a community liaison for the Caregiver Resource Center of Orange County. You're watching one of our live streams. This is our first live stream of 2026. So again, thank you for joining us. And like always, before we get into our topic, we'll briefly overview the services we offer as the Caregiver Resource Center of Orange County. Next slide. So a bit about the history of our center. We've been serving Orange County since 1988. We are a program of St. Jude Community Services. We are part of a system of California Caregiver Resource Centers. So there are 11 total in the state, and one resource center serves every county. Um, and we're funded through the Federal Older Americans Act and through the Family Caregiver Support Program. Next slide. So who are we? We are a trusted partner for Orange County families, coping with the physical, emotional, and financial responsibilities of caregiving. Next slide. Our center's mission is to increase the quality of life of caregivers by helping families and communities master the challenges of caregiving. Our goal is to make sure caregivers don't feel alone in their caregiving journey and have the proper tools to care for themselves and their loved ones. Next slide. And this slide here on the screen kind of gives like a brief overview of all we have to offer. We offer support groups both in person and virtual in 3 different languages, English, Spanish, and Vietnamese. For our registered clients, we offer individual counseling. With our family consultants, caregivers are able to complete a caregiver assessment and create a care plan for the future for their loved one. Anyone who calls our center has access to specialized information. They can call us about any resources that are happening in Orange County. And we also offer education and training. So we offer classes and legal workshops. And our most popular resource is our respite assistance. So we have grant funds that can pay for either in-home care or out-of-home care for a short time to give the caregiver that time off to themselves. We also have other grants that can pay for supplies and for cleaning services. Next slide. This is a handout we like to pass out to our caregivers. We find that once they do finally make that time for themselves, they're not sure what to do with it. So this kind of gives you some creative ways on like how to spend that time for self-care for yourself. You can walk outside, learn something new, and read a book. There's more than 50 ways to take a break. Next slide. Now we'll get into our topic for today's live stream, which is adult day services. Our stellar and experienced staff will be answering common questions caregivers have when considering adult daycare for their loved ones. Today we have Tanha Nguyen and Lou Rodriguez. So Tanha, hey y'all. So Tanha has been a community liaison at the Caregiver Resource Center OC for the past 4 years. She previously worked at an adult day program for over 12 years. She has been serving older adults and their families for the past 20 years. Lou has been a family consultant at the Caregiver Resource Center OC for the past 3 years. He previously worked at an adult day program for over 10 years. Lou has a master's in gerontology from USC with a bachelor's degree in psychology from Cal State Long Beach. He has worked in the community serving older adults and their families for the past 17 years. Thank you both so much for joining us this afternoon. We'll go through about 10 questions, and you both can feel free to share your answers and advice. All right, so we'll get into the first question. Next. So the first question is, what are adult day programs?
Thank you, Gabby, for the introduction. So adult day programs are a place where your loved one can go for the day. They do activities throughout the day. They do exercise in the way of like group exercise, and it's a place for them to interact with others, get some socialization, so some mental stimulation, but there's also the physical stimulation as well too of them doing exercise and being in a supervised group setting. So a lot of the things that they would do in an adult day program is similar to like what they would do in a senior center, but with a supervision component to it.
Thank you. And then we'll go to our next slide. And this kind of just gives like a brief overview of what Lou just talked about, the 3 different types of adult day programs. Next question. So our second question, what are the benefits of adult day services?
Thank you, Gabby, and for inviting us today. To answer the question, we came from the background of we used to work for adult day programs. We see the benefits of the adult day services that when our participants come into the adult day program, they improve their physical, they increase socializations, they feel that they belong to the programs, and the health monitoring while they there at the center, and of course to prevent institutionalization. And then the person that taking care of them, the caregiver, they at least have respite. They have a little time, a break from caregiving responsibilities, knowing that their loved one is at the adult program in a safe place and monitored, supervised by the staff. So, and also they know that they have peace of mind as a caregiver, and they also receive support and resources.
Thank you, Tonha. We'll go to our next question. So the third question is, what is the difference between the 3 types of adult day programs?
Yeah, so there's 3 different types of adult day programs. Well, actually, there's really 2. There's the medical model and the social model. But the reason that we say that there's 3 different kinds is because there's the Adult Day Healthcare Center, which is the acronym of ADHC, and then there's the CBAS program, which is Community-Based Adult Services. Now, both of those programs are the exact same thing. That is the healthcare model. But what differentiates those 2 programs is CBAS, the Community-Based Adult Services, is a Medi-Cal supported program. So if your loved one has Medi-Cal, they could go to that program for a set number of days each week, and Medi-Cal would cover the full cost of them attending that program. Now, if the person attending the day program doesn't have Medi-Cal, they can go to the Adult Day Healthcare Center, the ADHC, and then that would be paid for privately. So that would come out of the pocket of the family for that person to attend the day program. Now, if they have like long-term care insurance, or if they're connected to the VA, or if they're connected to the regional center, that all 3 of those could potentially pay for them to go to the adult day healthcare program. And then the other kind of program is an adult day program, which is ADP, and that is a social model. So in the social model, that's basically there for people that just need to be in a supervised setting, need maybe help to participate in activities, to maintain socially active. But in the medical model, what that includes is you'd be doing, physical therapy, occupational therapy, and there's a nursing supervision component to it. So in the medical model, the nurse can be helping out with medications if needed. They're doing exercise regularly that are monitored by physical therapy aides and occupational therapy aides, and a plan of care is made for them to do a set number of exercises each day that are monitored by those therapy aides. So that's what differentiates the medical model and that social model.
Thank you so much for sharing. And then we'll go to our next slide, which kind of like gives you like a visual representation of like the differences of services between the 2 different types or 3 different types of programs. Um, yeah, that Lou just explained. So thank you for that. And then we'll go to our fourth question, which is, what are the health requirements my loved one must meet to participate?
So normally that older adults that who either diagnosis with dementia, Alzheimer's disease, or cognitive impairment, or mental health, or older adult with regional center, normally the adult healthcare program will ask them to ask the physician to fill out the history and physical form, and it have to be signed by their physician, and that form will complete and turn it to the adult day program, and from there they will determine that either that person will more than like adult day program with social model, or adult day healthcare program that need nursing assistant or a PTOT. So that's normally that they will look, or the older adult that who, because of their either physical or dementia or cognitive or disabled, that they need support, they need assistance from their activity daily livings, such as eating, bathing, transferring, or walking, or dressing. So if they need minimum 2 activity daily living, that their daily tasks that they can't perform for themselves, then they will tend look into that requirement in order to for them to meet the criteria to attend. Is there anything else
Nice.
you want to add on?
No, like, yeah, so it's required to have like a health record before you start in the day program. And if there's going to be like any psychiatric diagnoses, there's also a psych health record that's usually requested too. So based on the health record that the primary doctor provides, um, the, the center will usually have a good idea of whether or not that person will qualify for the program, because as long as the nurse can be, doing something where she can provide some sort of support to that person, then they would be a good candidate to attend the day program, or at least the healthcare model.
Right.
Nice. Thank you both for sharing. Now we'll get to our fifth question, which is, what are some typical activities an adult day program might consist of?
Yeah, so part of what day programs do is they offer transportation. So they can pick up the person at their home, bring them to the center. They'll spend anywhere between like 4 to 6, sometimes 7 hours there at the program. And while they are there, usually they'll get served breakfast as soon as they arrive at the center. They also provide lunch as well too, and a snack. But they're doing activities throughout the day, and those activities can consist of, arts and crafts, musical therapy. Some offer like pet therapy, or other forms of like social stimulation. There'll be some sort of like group exercise as well too. Generally, once they do an activity, if they're in that healthcare model, then they'll do some physical therapy, some occupational therapy. And once they do the exercise, usually by that time, it's lunch, and the lunch is a hot lunch that's served, and each center has like a different varying menu. So they're provided lunch, and after lunch they'll go back to doing some sort of activity. Bingo is always very popular in day programs, and painting classes, or anything that will just kind of stimulate the mind. Some programs offer like gardening outside, or some sort of like walking, supervised as well too. So a lot of the things that they would do at that day program might be very similar to what they would do at a senior center, but just with that added facilitation of having a staff member help that person engage in the activity. So if they need that little bit of push, that's what the day program would, help that person to engage in the activity.
Thank you so much for explaining that. Now we'll get into we'll go to our next question. So what are the qualifications of the staff?
So the staff at the adult day program that and normally that requires nursing, so RN, LVN, CNA for medical, and there's a program director that oversee the program, activity coordinators that oversee activities, but then they also have activity uh, assistants that will help hands-on with participants. And we also have physical therapists that who will assess the participant when they first come the first 3 days for the assessment at the center. And below physical therapists, it will be physical therapy assistant that who will be on site every day to assist participant with physical therapies. And then beside physical therapies, we do have occupational therapies that require occupational therapists. It's also that occupational therapists that need to assess the participant for the first 3 days of their assessment there as well. And then occupational therapy assistant that's also there every day to assist them in the occupational therapies room. And then we also have activity staff that who, like Lou mentioned earlier, the activities on the daily basics. This is always the staff there to help them with all the needs during the activities. And of course, transportation, we do have transportation coordinators. We do to help them arrange to and from transportation to and from the center. And we also, of course, receptionists to help answer all the calls or the walk-in. And last but not least, we do have social workers that who will be the main contacts when the family members start calling, and social workers that the person that who's communicate, work with the participant family members, and will be the main person that contact back and forth with the participant family. And I think that's all the staff is for that, right?
I think so, yeah. Mm-hmm.
Yeah. But of
Thank you,
course
thank
they
you.
have to. Oh, and then all the staff need to have to do PT tests, and we do have a CPR training every 2 years that we have to have the training in order to be accurate.
Nice. Yeah, that's comforting to know that all the staff there, regardless of their role, are CPR trained.
Mm-hmm.
Yeah.
Yeah, but the nice
Now
thing is, if anything does ever happen, there is always an RN or a registered nurse on staff. So she would obviously be the first line of, to jump in if there's a health emergency or anything like that.
Right.
Nice. Thank you both. Now we'll go to our 7th question, which is, what information should I share with the staff about my loved one's needs?
Yeah, so as Tanha mentioned, social workers are part of the adult day healthcare program system. And they're usually the first people to make contact with the family and describe the program to them and, help with the enrollment process. So a lot of the information that the centers will have will come from the health record, but then also the social worker will do a psychosocial assessment with the person that will be attending the program. That usually involves the family as well too. And that's where they'll ask questions about like what some of their needs are, what some of their likes are, what kind of activities they enjoy or what kind of hobbies they enjoy. They'll also, screen them for depression and kind of do they'll do a mini mental status examination with them as well too, to see where they're at cognitive wise, and that's something that the social worker will continue to monitor. So yeah, based on the health record and what their diagnoses are, the nurse will make a plan of care of what things they should be monitoring for. So if a person's diabetic, or if they've had a stroke and they should be doing like physical therapy, the physical therapist will make a plan of care for them as well too, for what kind of exercises they will do. So the family should just be sharing, what kind of maybe struggles they've had at home, or what kind of things that their loved one maybe used to like to do. That way, that can be communicated to the activities staff. But the activities will also do an assessment with them when they first start the program, because the 5 main cores of social worker, activities, the nurse, physical therapist, and occupational therapist will all make a plan of care for them on what they should be doing each day that they're there. So with activities, they'll highlight, maybe things that they like doing. Maybe they enjoy music, or maybe they liked art, or maybe they just really like to socialize and talk with other people. So they'll try to gear activities towards their liking. So, in conjunction with working with the family on what the person's needs are, they'll also look at that health record and base it on their health needs and their social needs.
Yeah. And I think sometimes that is more information that the family caregiver share about their loved one. I think it's the better for the staff to well serve that participant while that he or she at the center. Because sometimes we have like some participant, they can't tolerate the noise, the loud. They need to be in a small setting due to their dementia, or sometimes some participant they're wet, but they refuse to change. So something like that, if the family members that understand know, like, oh, okay, what would our staff need to be aware, need to do in case of things happen, so that the staff at the center would be better to serve them.
Mm-hmm.
Yeah.
Thank you.
Nice.
Of course.
And thank you both. And now we'll go to our 8th question, which is, what are some questions I can ask when choosing an adult day program?
Normally, they will ask, is transportation included? What is included in the program? And what is the cost? Are they willing to accommodate the meals? Or what does the meals look like? And if they run, over the time frame, like if sometime that they come late to pick up their loved one due to their work schedule, what does it look like? And then the hours of operations, like how many hours that require for their loved one either to be at the social model program or at the adult healthcare programs. And they would ask, like, what is activities on the daily basis there. Yeah, and
I think you can also request like an activities calendar as well too.
Right.
That way you can see what they do throughout the week, and maybe gear the person's schedule on days that they have certain activities that they would enjoy. Yeah. So if a person likes music, maybe have them go on the days where they have musical therapy. Or if they were an artist and liked painting, maybe go on the days where they do arts and crafts or a painting class. That way there's more engagement and there's something that they would enjoy doing.
Right.
Nice.
Thank you, Lou.
Mm-hmm.
And thank you both again. And now we'll get into our next question, our second to last question, which is, what are the average cost of adult day services?
Yeah, so as I mentioned earlier, CBAS, the Community-Based Adult Services, the medical model, that is a Medi-Cal supported program. So Medi-Cal is health insurance for people that are of low income. If your loved one has Medi-Cal, they could potentially pay for the full cost of them attending the day program. So the majority of clientele of day programs are people that do have Medi-Cal. So for people that don't have Medi-Cal and are interested in sending their loved one to a day program, there's also private pay options. So if you're looking to attend an adult day healthcare program, that medical model, usually what you're looking at is anywhere between like 110, maybe 120, 130 per day. It depends on the program. Now, if you're just looking for the social model, if you just want somewhere for the person to go and do activities, maybe some light group exercise, eat breakfast and lunch, and have the transportation as well too, that's usually a little less expensive. It could be anywhere between like 88 to 105, 110 per day, depending on the program. But if you want to be in the social model, you have to be pretty much like independent in the restroom, or maybe just have like some light guidance in the restroom. And you should be able to manage a lot of the things on your own. Because if there's anything that the nurse needs to be monitoring for, or maybe needs to help that person in the restroom with, they probably wouldn't be a good candidate for the social model. They would need that healthcare model. So and then if you're looking at that, it's usually around $120 per day. But compared to having a caregiver at home through a caregiving agency, it does make a lot more financial sense having your loved one attend a daycare program, because it can attend for 6 hours plus transportation. That could be almost 7 hours, maybe 7.5 hours that they're at the program for $120. And that they were, cognitively stimulated throughout the day, physically stimulated throughout the day, that they ate breakfast and lunch, which all that's really good for them too, because they're building a routine of having somewhere where they go, 1, 2, 5 times per week. They just really thrive on having that routine. And it also, like Tanha alluded to earlier, it's also very good for the caregiver, because they get much needed respite while they're at the program, and they can rest and know that their loved one is being cared for in a supervised setting.
And I would like to add a little bit about private pay. Private pay, it could be from, like Lou said, out of your pocket, but then also if anyone have long-term care insurance, that could be covered too, or regional center.
Or the VA as
Or the
well too.
VA,
Some adult day programs also
Right.
have a contract with the Veterans Association. So if they're a veteran, check with the VA and see if they could potentially help pay for a couple days for them to attend the program.
Right.
Thank you, Tana.
Of course.
Thank y'all. And then now we'll show this next slide that kind of has like a table on like the average cost and coverage of adult day programs. So like Alu and Tana just mentioned, the out-of-pocket cost for an adult day program is around 75 to 90, probably more like 110-ish, that like we said. Um, and then Medicare, it doesn't cover the adult. There's no coverage for the adult day program. There's no Medi-Cal coverage for the adult day program. Um, they both don't cover the adult day healthcare. And with community-based adult services, it is covered through Medi-Cal. And then again, looking into your options with the VA and your long-term care insurance are also some other options to pay for the care. So thank you both.
And one more
And
thing,
now our
oh, sorry, Gabby. One more thing to mention to you, for adult day programs too, just keep in mind that most programs also have a 4-hour minimum. So when they're attending the program, they do have to be there for at least 4 hours. And that's especially true for the Medi-Cal supported program, that CBAS program. Because Medi-Cal won't pay unless a person stays there at least 4 hours.
Thank you. And now we'll get into our very last question of our live stream today, which is, what are some ways I can help my loved one adjust to attending an adult day program?
So we suggest that you open up a conversation early with your loved one, and start out like slowly. For example, just have them come like 1 or 2 days a week first, and slowly, and visit the facility together, so that they can be familiar, understand. Like we normally recommend a family member like come in on the first day, but not like stay next to the participant, like just to be on the back far out to monitor and to observe that how their loved one first days or first 3 days, and also build the trust with the staff, and the staff will be seeing all the information they have from the family member. They get to know uh, that participant well, and will help them to ease the anxious, because they would be absolutely that they would be anxious, and especially people with cognitive impairment, they have no idea where they are. So it's very important that the loved ones there, and make them feel that oh, you're not going to leave me here, because some participant, they scared that their family member is going to leave them at the center and not going to pick them up. So so that's why open the conversation as early as possible, so then they understand, and come with them to the facility, um, and meet the staffs, and slowly start with 1 or 2 days a week. And when they feel comfortable, then you can increase the days. And just monitoring the adjustment, and support the emotional, of course, is going to be a lot for them when they first starting something new, and something like they might be overstimulated with the group setting. So
Mhm.
yeah.
Yeah, change can be difficult for anybody, but yeah, when you have a cognitive impairment from dementia, Alzheimer's, or if you had a stroke or something like that, yeah, getting back out to a social setting can sometimes be a little scary for them. What I think might help out as well too is maybe to have them go to a senior center accompanied with their family member, one time a week, to start kind of reintroducing them to being in a social setting and engaging in an activity. It might help facilitate that transition to attending a day program where they would be doing a lot of similar things.
Right. Thank you, Lou.
Thank you both. And yeah, and that brings us to the end of our live stream today. I appreciate you both for taking the time this afternoon to share your wisdom and knowledge when it comes to adult day programs. Our team and our clients are tremendously blessed to have you both as resources. So thank you again. And for everyone who's watching, if you have any questions or need more support, feel free to give us a call at 714-446-5030. We have more resources on this topic on our website at caregiveroc.org. And yeah, just thank you all for joining us this afternoon, and have a beautiful, blessed day. Thank you.
Thank you.
Thank you.
Thank you.